Walk us through this development. Let's speak with the consultant public health physician, Dr. Alero Roberts, who joins us live now via Zoom from Lagos. Thank you, Dr. Roberts, for joining us on TVC News at 7. Well, this bill has made considerable progress within 5 months of its introduction in the House of Representatives. What is your take on its provisions?
Thank you very much for having me. And yes, I'm noting with surprise the speed with which the bill is passing through the House of Reps, and I can only attribute this to the emotion that lies behind the idea that there should be a bill to make sure that healthcare for children is free. However, there are a lot of questions that have been asked and still need to be asked. Is this based on evidence? I mean, what is the evidence for this? Just a few thoughts that we have concerning this is that how is it going to be funded? Already we know that the health system in Nigeria is grossly underfunded and has been so for decades. I mean, there is no single year that we have met even the minimum 15% budgetary allocation to health. And then you're talking about having health care for children up to the age of 18 for free. This is almost 57% of the population of Nigeria. I mean, has that been thought about? How does the government intend for this to be funded? And then the next question I'm asking is that, okay, then what happens to primary health care? Already that is grossly underfunded, grossly understaffed, grossly mismanaged. How do we deal with this duplication of efforts? So I can understand the emotion behind the bill, but I think something that would have been more cogent would have been looking at what are the existing strategies in place, what are the existing policies, and seeing how these can be strengthened.
Well, Dr. Roberts, as it is, these two issues you mentioned, fundamental issues, were some concerns that some members of the House of Representatives raised yesterday. The issue of funding and the fact that it might just amount to duplication of the services of the National Primary Healthcare Development Agency. So at this point now, what suggestion would you give to the lawmakers?
I would suggest that they call for papers that establish the evidence for this. So let's see what are the numbers that we're talking about? Let's even look at just routine immunization alone. The cost of routine immunization alone to fully immunize a child up to age 2 years is $10 per child. 0 to 2 years constitutes 2% of our population. 4 million children. Have we allocated $40 million just to routine immunization? What has been the total health expenditure to date? Where have we lapsed? So these are questions that I think that the House of Reps can demand the answers for, because the answers are there. They just haven't asked for them. And we need to have them do a far more detailed deep dive into some of these things before emotionally passing a bill like this.
Well, in the various arguments during plenary, we actually had the Speaker of the House mention that, ask questions as to, is the primary healthcare services being delivered? Are they actually free? I mean, in totality, are people actually enjoying it to the extent that it is meant to be? And then he felt, as just like other members, that passing the bill would probably make way for the funding. Do you buy into that as well?
No, not for a minute. I mean, let's be honest. There are so many policies that we have passed in this country that the implementation strategy has not been put in place. We have not even fully implemented the National Health Insurance Scheme. Well, we've got it only for civil servants. We haven't got it for the totality of the population. Where is the money supposed to come from?
All right, very serious.
These are questions that we need to answer.
Indeed, very serious questions. And perhaps when it gets to the time for public hearing, perhaps there would be more voices heard, and there would be a reconsideration, because apparently there were voices against going ahead just with the emotional urge to, make the bill run really fast through the assembly without properly looking into the implementation strategy, just the way you have mentioned, Dr. Roberts.
That's it.
So I would expect that you, along with other practitioners, would just look for some way to raise your voices so that we better understand this bill and we do the right things, putting the right pegs in the right holes. Dr. Alero Roberts.
Thank you very much. I hope the public hearings will be truly public.
All right. Consultant public health physician from the Lagos University Teaching Hospital, LUTH, Dr. Alero Roberts. Thank you very much for your insights at this time.
And thank you for having me.